honestly, it's ironic, but like the one thing I won't guarantee is a baby. Like I know I have nothing to do with that. And I actually want to be clear with that. And it's really what I aim to do is equip you, to have a strong system that helps you manage how difficult this journey can be and really try to have this be a discovery period to help you learn self-care methods that will equip you later in life with other adversities and really learning how to talk to yourself as you would your best friend, and showing yourself the kindness and empathy that you deserve. And really just giving yourself the support that you need.
Welcome to Baby or Bust. I'm your host, Dr. Lora, Shahine, and I am tired of infertility and miscarriage being misunderstood, hidden, and full of stigma. Welcome to the podcast with interviews and in-depth discussions on topics all things reproductive health. When it comes to raising children, it's common to hear the phrase, "it takes a village." Well, what about support before the baby is even conceived? Someone going through fertility treatment, especially IVF, will have doctors, nurses, family, friends, possibly acupuncturists, therapists, and more people supporting them through the process. This is your community. This is your village, your team. Well, fertility coaches have increasingly become more and more popular part of the fertility team. And today we're going to be learning from a fertility coach, Ceire Nevins, all about her role in helping with family building. Thank you to our friends at Seattle Sperm Bank and Greg Moga for sponsoring the show. Please take a moment to give us a 5-star review anywhere you listen to your podcast. It really helps people find the show. Ceire, welcome to Baby or Bust.
Thank you so much. I'm so happy to be here.
I first found you on Instagram because you posted this cute reel of walking your dog, and you had earbuds in, and you were like, "I'm listening to one of my favorite podcasts. These are my top 5 fertility podcasts." And you listed Baby or Bust. This was like a year ago or something.
Yes. I've been like such a fan of yours for years. I admire all you do and all the education and everything you provide for the community. I think it's incredible. So I was happy to give you a shout out.
Thank you. Well, I appreciated it, and I shared, and then I followed you, and I was, more and more of my patients have talked about fertility coaches and sort of asking me for recommendations. And of course, my patients have therapists and they have acupuncturists and nutritionists, but I've really seen an increase in people using fertility coaches and reached out, talked to you. I remember at the end of our conversation, I was like, I feel like I'm hearing myself, talk and like how I often talk to patients. And so I knew we were going to have a good connection. We kind of share a lot of the same philosophies. And I wanted you on the show because I wanted to be able to say, hey, this is what a fertility coach could be and kind of what it's like. And so tell me, what is a fertility coach to you, and how do you navigate this journey with your clients?
I think it's really like such a personal experience because I've been through it myself. And so it's really about connecting with somebody and really helping them through those really tough feelings that we really carry shame and guilt on with infertility, because it can often be suffered in silence and so not spoken about, and it's hard to kind of navigate on your own. So I think just really being there to support somebody and help them through that negative self-talk and show them the self-care and, help them set boundaries they may need to do, and really just connecting with them in an area that, like, meeting them where they're at on their journeys and trying to help them navigate such like horrible terrain, to be honest. So
it's like that support, kind of that coach. And is there a particular part of the journey that most people come to you, like they haven't even started trying, or they're trying but they haven't connected with a fertility doctor yet, or they're deep into their 3rd IVF cycle? Like, is there a pattern, or is it just all over?
It's actually all over, which I love about it. And I think it really stems from, us not getting the education that we need about our bodies as women. And so what I am really passionate about, I've helped women really learn about their bodies through Toni Weschler's book, Take Charge of Your Fertility, which I know you've had her on, and she's just, I'm so grateful for all of the knowledge that she has shared, and that book in particular, because it helped me so much with my infertility. And so it's a staple that I recommend to all of my clients, like especially if they're just starting out on their journeys to learn about their bodies. It's about kind of fertility education, like we said. And then there's women that have reached out that are already started their IVF journeys. And so I've kind of helped them to really support them and empower them to continue or with areas they're struggling in.
What is the difference between a fertility coach and a therapist? Like, how does that differ?
I feel like that's a really common question. And really what a therapist is really trained to help with mental illness, and they are, focused on kind of healing the past and creating a better future, whereas a coach is really there to help you advocate for yourself and empower you to make the best decisions for you on your journey. So it's really kind of actionable, and they really hold you accountable. So it's focusing on that present moment and then working towards your future goals together.
Oh, that is a great explanation of a difference. That makes a lot of sense, because people sometimes say, well, I don't really need a fertility coach. I've got a therapist, or, vice versa. And I'm like, I do know that it's different, but I think that was a really good clarification. Where do you draw the line between giving medical advice or coaching, like answering, medical questions? And how do you navigate that when because patients will ask you everything, I'm sure.
They do, but I think they kind of know, and at least I lay that foundation that I am not a medical profession in the medical field, and I leave that definitely entirely to the doctors and the experts on that. In the areas that I can help with that is really just encouraging clients to advocate for themselves. Like, for example, one client that I had, she was going to do an HSG and
hysterosalpingogram.
Yes, I'm glad you said it.
Yes. Well, it's we talk fertility talk every day. So HSG, hysterosalpingogram, that test to make sure the fallopian tubes are open, and
absolutely
nerve-wracking because people share sometimes it's painful or crampy, and so I can she was nervous.
Absolutely.
I bet.
And she was nervous, and she had that experience where it was very, very painful, so she had to stop. And then she had asked her endocrinologist if she could have pain meds to do it again, and they had said no, they would only do anxiety meds. So just kind of talking with her, and I, encouraged her to advocate and maybe find another endocrinologist, which she did, because she wasn't, already kind of aligning with them. And so she found a new one, and they had said they would give her pain meds and anxiety medication, but they actually suggested to do a laparoscopy instead. And it turned out she was able to do that with the HSG. So she was under anesthesia. And then they discovered she had a blocked fallopian tube and endometriosis. So it's just kind of empowering clients to advocate for themselves if something feels off on their journey. So I never, ever give medical advice, because every person, well, one, I don't have the qualifications or the knowledge, but two, every single experience is so different. And so I would never interfere with that.
Yeah. Well, and there are doctors out there, providers that, are just kind of nervous about their patients seeing a fertility coach, because they are nervous that they're going to, confuse the patient with, medical recommendations. And, that's one of the reasons I reached out to you, is like, I just want to know like what your philosophy is and what your, your role is. And the two of us are kind of really aligned. Like, I see you as an advocate, someone to, ask questions of, but I never got the feeling that you were going to tell somebody to do some sort of certain protocol for their IVF cycle.
Absolutely. Yeah. No, it's really, really like a guide on the side, and someone to really, help you, empower you on your journey, and just help you, encourage you to advocate for yourself, and always kind of make decisions that are aligned with your values, which is really important, because I think through all the noise of infertility, we can kind of lose ourselves and our values and what is true to us. So I think it's just having someone there in your corner, making sure those decisions make sense, are best for you is really important.
I love that. And how did you get interested in becoming a fertility coach?
It was honestly my own personal experience. I had never even heard of a fertility coach prior to kind of getting to that really low point of needing one myself. And this was about maybe 4 years ago when I was going through a secondary infertility. And I really lost myself in the process. I was kind of living on autopilot and was just losing the joy in front of me, even with the children I had. And so I found myself like needing to find help and Googling online, and I found a fertility coach. And even just from that, I never ended up hiring her because from that one call alone, I heard myself and I was not coming from a empowered place. I asked her at the end if I could pay her through Venmo so my husband didn't have to know. So that was a big red flag that just we were not, I wasn't aligned with my husband on having another child. And it was an unconscious belief that I was tying my happiness to that I wasn't really as aware of. And so through her, though, she became a great mentor, and she told me about the School Institute of Integrative Nutrition, which is where I ended up getting my health coaching certificate. And really through that process, I just went through my own self-discovery and growth and resolve and, really learned why I was where I was and how to kind of find peace with it. And I really, instead of birthing a fourth child, I feel like I birthed a new career as a fertility coach. So it really just, infertility in general, it just really shaped the person I think I was meant to be. And I think, knocked me down, but in a way that I could rebuild myself back up to a better person. And I really just was so passionate about all the tools that I've learned that I've wanted to share that with other women and be what I wish I had on my journey.
Oh, that's beautiful. And I feel like I'm really connecting with people on this podcast that honestly have been through their own journey and now they're finding ways to give back.
Yes.
So I do think that, of course, the fertility community is a club that nobody really ever wants to join. But once you are there, you can find this incredible support. And a lot of people kind of look back and would never wish infertility on anyone, but they sort of learn and grow themselves. And like you said, build tools. And now you're giving back. And just, think about that one interaction with a fertility coach that truly changed your
whole
perspective on life and your trajectory. And that's really, really astounding and just beautiful. Yeah.
Thank you.
Yeah. I'm curious about your training and like what does it mean when someone says I'm a fertility coach? Like, is there a standard or?
Yeah. So I think, because it is kind of such a newer field, there is no kind of universal certificate. I think the unifying aspect of a fertility coach is being able to really ask those good high mileage questions and to be able to guide the client to be able to make the best decisions for themselves, aligning them with your values. And so I think that's kind of that universal foundation. And then for me, my training was through the Institute of Integrative Nutrition. And his philosophy, Joshua Rosenthal, who runs the school, is kind of there's your primary foods and your secondary foods. So primary foods are everything that you put in your body, and your secondary foods include your relationships and your career and your finances and your well-being and your spirituality and movement. And so really, if you feel out of balance, one of those areas is lacking or maybe multiple. And so being sure to look at the person as a whole instead of just, because I think sometimes, especially with fertility, we can follow such a restrictive diet and be like, I'm perfect though. Like, why am I not getting pregnant? And so it's most likely because some other areas are out of balance, and it's important to kind of make sure that you're giving those areas focus as well, just to feel your healthiest self. And so I feel like that basis of my training and the mind, body, and stress techniques that I learned through them, such as meditation and journaling and practicing gratitude and movement and all those holistic tools are what I'm really passionate about teaching my clients and having them explore those areas as well and see how they can kind of help set up a stronger system for them to manage the adversities of infertility, which can be so challenging, as we know.
Yeah. So is your certificate specifically for fertility, or was this like a life coaching?
It's called health coaching. So,
Okay.
so my specific training for the Institute of Integrative Nutrition is a health coaching certificate. And so really my fertility coaching experience comes from my own personal experience, and then just my passion for researching and finding the best credible resources and ways that would have been helpful for me or maybe were helpful that I can pass along to other people. So I think that what's kind of unique and cool about the fertility coaching world right now is that there are no current regulations and people can really tailor it specifically. So, there are fertility coaches like for donor conception or surrogacy or IVF or really specific to endometriosis and PCOS. So you can get really granular and tailored if you prefer. But kind of what you and I touched on earlier is, in my experience so far, I've worked with kind of a wide variety of women because I really feel like what I'm equipping them with is like a strong system and then guiding them to make the best decisions for them. And so I have worked with women that have ended up adopting or have gotten pregnant naturally or have gone through IVF. I haven't done donor conception or surrogacy yet, but that would definitely be something I would be willing, because I know we could figure it out together. So it's really kind of a partnership as well, I'd say.
Yeah. And so what's it like? I mean, I know you're in Boston, right?
Yes. Yes.
And I know that my patients can work with you kind of like online, but
virtually.
I'm just curious, like, what's it like? I mean, do you have set meeting times? Do they reach out with email? Like, how do they connect with you? What's it like?
Absolutely. So everything is virtual as of right now. And so I have 3 different packages. So there's a basic package where you have a call every other week. And the duration can be up to the client. So I really encourage starting with 3 months, just because it's a good amount of time to get to know each other. And even if you do fall pregnant, which has happened, which is amazing, clients find it beneficial to work through the beginning of their pregnancies as well. And then the second package is standard, and that includes unlimited email and text, but it's always a 50-minute call every other week. Although the premium package, which I've done with some women that are doing IVF and just kind of want a lot of support for that 1 month, is a call every week.
That's great.
And then emails and
calls
text as well.
And emails and text. That's great. And then I would love to think through how, if someone was thinking, okay, a fertility coach sounds like a great support. Let's talk about what we would tell somebody to look for with a fertility coach. Like, what are maybe the top 5 questions that someone should ask? Because it usually starts with at least a phone call or an interaction to sort of see if it's a good fit.
Yes.
If you had a friend that was looking for a fertility coach and you would say, oh, make sure and ask this person these 5 things, what would they be?
Okay. I think I would definitely want to have them check for credentials of some sort of coaching certificate. I don't think it would have to be specific to fertility, because again, kind of coaching is that process of asking the high mileage questions and really guiding the person to make the best decisions for them. And so I would ask them to look for credentials. I would tell them to probably ask them if they have experienced infertility themselves. I don't think that's a prerequisite. But I think that it can be really helpful, just because some of the feelings that accompany it can be really unique and harder for other people to understand, I think, if they haven't been through it. But not to say that, if you really clicked with someone that hadn't, that would be a reason not to. I would tell people probably just to really do your research, and, if they're on Instagram, maybe see if you can follow along on their reels or their content and connect with them first, and probably have them check in with their pricing and make sure that aligns with them as well, of course. And I think it's really just about, clicking with that person and making sure that you jive with them. I think whenever I do get that call, I feel I understand how vulnerable and how hard it is to ask for help. And so whenever somebody calls me, I always start with there's absolutely no pressure. And this is just a zone for us to get to know each other and share what you're comfortable with your story. I'll even share mine, and we can see, how I could help you and if you think it's helpful.
I think that's great. I think, you said credentials, aligning, connecting. It's just like, so I'm a fertility doctor that did IVF and had infertility, but there are amazing doctors out there that have not struggled with fertility, but it's like you might connect with someone who is really talking about these feelings and has, been at a party where their friend announced that they were pregnant and you felt like you got punched in the gut. Like it's
Exactly. Yeah.
And then I would add to what you said, maybe some red flags.
Yes.
And these are things that I was kind of, looking for a little bit when I was chatting with you the first time. I would think it's a red flag if someone over promises, like if you work with me, you are going to get pregnant. That's a big red flag.
Absolutely.
And then I think it's a red flag if they're really focused on like a very strict diet or exercise routine or supplement regimen. I personally think it would be a red flag if that coach is selling supplements. I mean, maybe they could work with a company and have discounts or something like it. Like, I'm not saying that that's like you can't do that, but just sort of like if someone is like not really certified and they're putting themselves out there on Instagram as a fertility coach, and when you connect with them, it feels like a sales pitch, like
absolutely.
Sign up with me and you're going to get pregnant and I'm going to tell you exactly what to eat and I'm going to tell you, which supplements to buy. I just think if you're walking away feeling like, it's like a sales pitch, or that's a little bit of a red flag.
Absolutely. And even on the nutrition topic, I think unless you're a registered dietitian, like that can be really dicey too. And I think, honestly, it's ironic, but like the one thing I won't guarantee is a baby. Like I know I have nothing to do with that. And I actually want to be clear with that. And it's really what I aim to do is equip you, to have a strong system that helps you manage how difficult this journey can be and really try to have this be a discovery period to help you learn self-care methods that will equip you later in life with other adversities and really learning how to talk to yourself as you would your best friend, and showing yourself the kindness and empathy that you deserve. And really just giving yourself the support that you need is so important.
Yeah. And something that you and I connected on and we align with is just understanding that spiral of like, okay, I'm going to completely cut out gluten because I saw an Instagram post that it's inflammatory and everyone should stop eating gluten. And then if you don't get pregnant that month, okay, well, then I wasn't good enough, in air quotes. I didn't read every single label of every single sauce, and then you just kind of get on this sort of like shame cycle and sort of spiral where it just, when people, I think, are selling these detoxes or these really strict diets or like that, I would look for that in a fertility coach because at first, it feels good because you feel so out of control in your fertility journey. Like, why am I not getting pregnant? I'm doing all the things. And so if someone is saying, hey, I've got this list of things to do, and that's going to make the difference, it feels comforting at first. And you know what? If you get pregnant in the first couple of months, like that's great. Maybe it was whatever you did, but it can really start to backfire. And there can be a lot of shame that kind of comes out of it. And I really, like a lot of what you talk about really resonated with me, just kind of the support and kind of teaching and learning about endocrine disruptors, like toxins that are in household products that can, in high levels can impact our fertility and our health, but also not making people so scared to have a piece of plastic in their house, And so I just felt like if my patients are getting a little bit of extra support from you, they're not going to be coming away from it feeling more shame. They're going to be coming away from it feeling just supported and empowered. And like you said, you help people advocate.
Absolutely. And it's about like progress over perfection and making any small changes that can compound over time that work for you and your body. And like you said, there's no need to kind of prey on the weak and add more, stress and layers. I feel like to infertility, it's already such a struggle. And I think it's just, about doing your best, one foot in front of the other each day, and not trying to disrupt and come from too much of a restrictive time, and just really trying to live your life through it as well is so important. And just to not, because if you stop living, life's too short, you go on autopilot, and then you just lose yourself, and it's so hard. So making sure to get that support.
Absolutely. You can lose yourself in the journey because you just become so laser focused on the goal of having a baby, and everything else just, kind of gets set aside.
And that's a part I'm just like super passionate about, is getting out of that goal mindset, like mentality, and trying to move you into a system-based mentality with just, I have these 4 simple S's: support, self-care, self-talk, and setting boundaries. And they're just kind of the pillars that we work throughout, and can be so helpful to, reframe out of that. I'll only be happy when I have this baby or when I grow my family, into living your life throughout it and being happy and finding joy throughout the journey.
I love that. I really love that. And I also like that sometimes people get overwhelmed when I sort of say, like, okay, who is your support team? Do you have an acupuncturist? Do you have a therapist? And sometimes people are like, listen, I have so many visits, with you, Dr. Shahine, because of, the IVF cycle. How can I fit anything more in? And I think because you're doing it virtually and, you can kind of tailor it. I think that that's helpful. And there are lots of patients out there that I really wish that they would get a therapist, no matter how much I, recommend it. There's just sometimes a stigma around it, or just not wanting to face some of the stuff, from the past, or just not the right time. And so I think that fertility coach that is also just that support system, like for someone, in that moment, that can be really helpful. And maybe they can come to therapy later in life. Yeah. I'm not sure,
Absolutely. And I mean, it makes me think of one of my clients that honestly, she was a nurse and is always just so focused on helping other people. And it was so hard for her to ask for help and to really like give herself the self-care that she deserved, and to speak to herself kindly. Like, she just felt like she should have to push through this and do IVF, and that in her own words, she kind of worded it like, how am I special than other people that go through IVF? Like, I should be able to just do this on my own. And so working with her and seeing her put in those self-care techniques and really begin to use affirmations and mantras and realize and show herself the empathy and kindness she deserved was like such a beautiful thing. And to see her get pregnant in the end was such a wonderful thing as well.
That's wonderful.
Yeah.
I really appreciate you. And how can people find you?
So people can find me. I have a website, The Fertility Mama, which is MAMA, and then through Instagram as well, and TikTok as well. And I think that's all of them for now.
That's perfect.
Yeah.
That's wonderful. Thank you so much for coming on the show,
Thank you
Ciara.
so much
really
for having me.
It.
I so appreciate being here. Thank you.
I hope you enjoyed that conversation with Ceire Nevins as much as I did. I have certainly learned a lot about how fertility coaches can help people navigate this roller coaster ride of a fertility journey. And it's not for everyone, but I really think if you are looking for support in a different way, it's something to consider and just learn more about, because I certainly have enjoyed doing that. You can find this episode and all others on my website, drlorashahine.com. More educational information on my YouTube channel, Instagram, TikTok. I just love teaching teaching, send us an email to hello@drlorashaheen.com to share topics that you want to learn about and people you'd love for us to interview. Thank you to my producer, Shannon Perry, and her team at Audiotocracy. This is your host, Dr. Lora Shaheen. See you next week. And until then, wishing you love, luck, and pineapples.